Hand hygiene for 20 seconds. Hello. I'm your nurse again, Nurse Johnson. And before I do anything, can I get your full name and date of birth? Jane Smith, July 5th, 1950. Okay, let me just go ahead and check your band real quick. Okay, right there. And I also noticed you didn't have any allergy braces on you. Scan that. Matches my records. And I noticed you didn't have any allergies bands on you. And I know it's your last time, but I just need to make sure again. Do you have any allergies maybe towards, or something I didn't know of beforehand? Maybe towards tape or iodine? No? Okay, perfect. So your doctor actually ordered me to put in an order for the removal of your urinary catheter. Like last time, it's going to be relatively quick, maybe even quicker. And you'll feel some discomfort, but like we did last time, I'll just guide you through the process. And then we'll be on our way from there, alright? Okay. And I know that I'm a male nurse, and I know the last time you said it was fine. But do you want a female nurse to do this instead? No, I'm fine? Okay. Well, let me just get everything set up and I'll be right there. Alright? Close the curtains for privacy. Like I said, this should be a little painless. All I'm going to do is I'm going to deflate the balloon inside you and then pull out, alright? Okay. Let me just get the rest of my supplies. Okay. I'm going to assist you into the frog-like position again, going under the knee and on the foot. Let me just place down this chucks real quick. Okay, let me just get the rest of my supplies out. So any concerns before I begin? No? Okay. So I'm actually going to go ahead and remove this stat lock. Leave that there. Use the alcohol wipe to remove it. Okay. Toss that. Let me just change out my gloves real quick before I begin. Hand hygiene for 20 seconds. Okay. So like I said, all I'm going to do is deflate the balloon. And then after I deflate, I'll pull out and we'll do the same breathing thing we did last time, alright? Let me just remove all the water out. Okay. Okay. And 10 cc's of water has been pulled out. Okay. So I'm about to pull out, alright? So just take a deep breath in, and I'm going to count down to 3. I'm going to pull out, alright? And then when I do, just breathe out. Take a deep breath in, and 3, 2, 1, breathe out, keep breathing out. Okay, perfect. And did you experience any pain through that? No? Okay. And just a pause real quick. If there was some resistance pulling out, I would push back in and then continue removing water and then trying again. If there was even more resistance despite that, I would leave the catheter in place and then phone the provider and let them know. Okay, so you said no pain, correct? Okay, perfect. Well, I'm actually going to go ahead and measure this, so I'll be right back. Measured in the bathroom using a graduated cylinder. Looks like you have around 200 milliliters of water. I'm just going to go ahead and get rid of this catheter. And then, so just a few things before I leave. So on your first 2 urinations, I want you to measure out the amount you urinate. This is just to make sure if there are any problems with your bladder. So just make sure you measure after your first and your second one. And on your first urinations, you might feel some burning or stinging. This is actually normal, but if it continues after your first one, please let the nurse know, alright? And we'll be there to assist you. Alright. So if anything, Your call bell is to your right, and then do you need anything else before I leave? No? Okay. Well, thank you so much. And you said you didn't experience any pain, correct? All right, perfect. All right, I'll just be on my way now, all right? Hand hygiene for 20 seconds. And I would document the date and time, the amount, and the description of the urine in the Foley, and if the patient tolerated the procedure or not.